Good morning, everybody. It's good to see you all. Happy Father's Day to all you dads out there. It's a big day. It's a wet day, but a good day for us to just talk about Haiti, I think, and I'm glad to do so. So, how did I get started with Haiti? We, as a fourth-year surgical resident at Yale, we were required to go to Haiti for 3 months and work at the Hôpital Aber Schweitzer. For my wife and I, we had just been married a couple months, so it was like an extended honeymoon. But I felt it was a great opportunity to see what the third world countries are like with regards to surgical access, and I found that they really lack surgery. I came to find out that 75% of the world lacks surgical access. And when we were down there at this hospital in Haiti, it was a real privilege to work with one of the Haitian surgeons who I still keep in touch with and talk to. And he was a terrific surgeon. Showed me a lot about surgery in third world countries and how to do things like hysterectomies and suprapubic prostatectomies and operations that I wasn't, as a general surgeon, accustomed to doing. And you had to do it all down in the third world area. So it was a great experience for me, and I think for my wife as well. We met the Mellons, who were just unique people. He had built this hospital down there, and so it was an experience of a lifetime, and had a huge impact at that point. I went then on to do a vascular fellowship down at Baylor College of Medicine in Houston with Dr. DeBakey, and then we came to Kansas City, where I joined a private practice and practiced both general and vascular surgery at Research Medical Center. In the early 90s, the church was getting a team to go down to the Dominican, and my wife, who's obviously picks up these things better, quicker than I do, said, this might be something you might be interested in. And so indeed, I went with the Dominican team down to La Romana and started doing surgery in clinics down there. Now, these were real small clinics, and we were operating on Haitian sugarcane cutters and their families. And then when the Good Samaritan Hospital was built in La Romana, that opened it up for me to work with the Dominican surgeons. And we worked on laparoscopic surgery and general surgery, and also I taught them how to do vascular access surgery for dialysis patients, I worked with a lot of surgeons from all over the Dominican at that point. And then the life changed for me at 2010, 2010, when the earthquake occurred, January 12th. And my daughter was down there at the time, and she was working in a medical clinic. And we were able to get a hold of her, finding out that she was okay, and the clinic had fallen in, but they were still operating or working on patients that became from a medical clinic, became a MASH unit. You can imagine what that's like with limbs lost and death and so forth. And she stayed down there. And we were on our way to Africa for a mission trip in northern Ghana. And I said, listen, Mom and I can change our plans and come down to Haiti. She said, Dad, there's no operating rooms for you down here. There's nothing for you that you can do down here. And that really bothered me, quite honestly. So when I got back from Africa, I had a Haitian-American nurse practitioner who was working with, and she came to me and said, I've got a little delivery room that we can work in, and that'll be a place for you to operate. Great. So I put together a team, and we went down in November of 2010, and that was the first of our trips. And then from there on out, we started taking more trips. And I think we can get started. Let's roll here. This is just Haiti is on the left-hand side. I don't have a pointer, so I'm just going to try to, but it's on the left-hand side of the island. It's the island of Hispaniola. The Dominican is on the right side. Haiti's on the left. Haiti's all mountainous, and the Port-au-Prince is the capital of Haiti. Right now, when I go down there, I fly into Santo Domingo, but La Romana is over on the right-hand side of the Dominican Republic. Next. This is the surgical center. You can see we're outside of Port-au-Prince, which is really a blessing. Right now, Haiti is controlled by gangs. There are 5 major roads that come out of Haiti, and we are on one of them. It's the main transport between Santo Domingo, the capital of the Dominican Republic, and Port-au-Prince. And I'll show you the road in a minute. But the gangs basically extend out to Gantier. We have not been, we take care of gang members and we take care of gang victims and innocent bystanders, which is a problem, but because there are a lot of injuries down there right now that we're working on, but the gangs leave us alone, which is really great. And we have access to the Dominican Republic through the border, which is right there on the right-hand side. Jimini is in the Dominican Republic. So getting supplies and medications, we can still do that. And that's a real big deal because a lot of the facilities in Haiti have shut down because there are no, they don't have access to getting supplies, medicines, or even food. Yep. So in 2010, this is what the center of Port-au-Prince looked like. Devastating, terrible problem. They still haven't recovered fully from that. This is the road going from the Dominican to our clinic, the main road. No, you wouldn't think it's the main road, but it is. And this is what you travel on. And in the Dominican, it's a 2-lane, sometimes 4-lane highway. And then as soon as you hit Haiti, the pavement stops and you're on the dirt. Yep. This is a little operating room that we started with as a delivery room on the campus of Haitian Christian Mission. It was a nice facility. We were doing some big operations, though, abdominal procedures and thyroids and procedures that were really, it was like operating in a broom closet for a surgeon, which isn't a good place to be. But and I realized that, something had to change. I was trying to get together some teams to build this, and we couldn't agree on how to get the money involved, and so I just said, well, we're going to build it. So I decided to build a surgical center. Go ahead, next. This is operating in that little facility on there's some Haitian medical students. Every time we brought a team down, which was 3 or 4 times a year with other surgeons and nurses, and some of you may have been down there on the trip, but this was a great learning experience, and that's my daughter, who is now a surgeon, and she's a urological surgeon, and working with me down in while she was still a medical student. Yep. This is one of our American teams down there that we take down about 15 to 20 people, nurses, doctors. I even took a lawyer, Gary Anderson, was from our church here. He went down. He actually ran one of the operating rooms down there, which was really, I was ooh, but it turned out to be just fine. Gary did a great job, and he's a terrific guy. But it was, anytime you can get people down to Haiti and have a shared experience with Haitians, it's a wonderful experience for everybody. Yep. So one of the things we wanted to do was work with the surgical residents, and I set up a program with the General Hospital in Port-au-Prince. They would send out their residents when we'd go down there, and we'd work one-on-one with their residents. And this is one of my partners, Joe Cates, who's a very fine vascular surgeon, and he's, we're working with the residents. And the resident that I'm working with on the right-hand side is Peter Synthosiak, who became chief of surgery. When he finished his residency program, I asked him, what are you going to do when you finish? And he said, I'm not sure. I'll probably leave Haiti, which 95% of surgeons leave Haiti. And I said, well, how about sticking around and building a program here? Get some of your good friends who are interested in staying in Haiti, and let's build a surgical program that we can take care of trauma, emergencies, elective surgeries, and go from there. And now we have 83 medical staff members and 16 surgeons and anesthesia, and it's a busy place. It's 24/7 trauma center. But he's really been an instigator. One of the things we worked at, this is his partner, and one of the things we worked on here are vascular access. when I went down there, I got to know Paul Farmer. If any of you are involved in mission work, Paul Farmer is the Babe Ruth of medical missions. And he basically, when he talked to me one day and he said, you know, Ted, when you go down to Haiti, you're the only vascular surgeon for 11 million people. And I said, Paul, we got to change that. So I'm working with my surgeons to teach them vascular access surgeries and how to do vascular procedures while we're down there. Unfortunately, we lost Paul about a year ago, which is a huge loss for the whole medical mission community. Yep. One of the things that we see not infrequently down in Haiti are thyroid goiters. Surprisingly, they have a lot of these goiter problems that come out. These are two young girls out of the mountains, and they're underdeveloped. I think they're 11 and 8 years old. You can see they're not very big. But we were able to, our Haitian surgeons did the surgeries, and I was really proud of the job they did on both of them, and we gave them some thyroid medication, and they're doing much better right now. But we have things like that happen all the time. We had a woman that walked in a lot of our patients have to walk in, they come out of the mountain villages, and they don't, there's no taxis. And one woman came in, she was turned pregnant, a 25-year-old, and our nurse midwife, who normally does all the deliveries, delivered not one, not two, not three, but 4 babies. All survived. No pre-op, anything, no anesthesia, no nothing. And the babies are all doing fine. So quadruplets is something certainly you wouldn't vaginally deliver, but second of all, they're all doing well, and it's kind of a tribute to our nurse midwife staff, who are all excellent.
How about the mothers? How are they doing?
Pardon me? The mother's okay. She's doing okay as well. She's still walking. Go ahead. This is out in front of the emergency room, the typical sort of waiting area there for us, and it's a busy place. And the reason it's busy is because it's pay what you can, and we operate first or work first and then pay. Whereas most Haiti facilities, you pay up front. You have to pay, and it's much more than what we would charge. And so we see a lot of patients from all over Haiti. Go ahead. Now, in the lower peninsula there, in the middle part, you can't, I don't have a pointer, but there's a city called Lakai. In August of 21, there was another violent earthquake there. And I got a call from our medical director saying, we'd love to have your team come down. And he said, I'm taking everybody. Would you like to join us? And I said, absolutely, pick me up at the airport. So we did. Go ahead, Alice. And the road, we couldn't take the main road because the gangs were in control. So we had to go over the mountain. And, that was a pretty harrowing experience when you're in a truck and you're driving through roads like this over the mountain. I mean, it felt like a ski slope. And, it was, but it took us 8 hours. We finally got there. Go ahead. And because we had supplies and we had a complete surgical team, they gave us a hospital at Port Salut, which is on the southern coast there of the peninsula I showed you. And, we got in there, and the whole galley was full of patients just waiting for surgery. And our orthopod he's a hero, and he just stayed there and worked as long as he could every day. We were there. Most of the chest and abdominal trauma, those patients had died. So there wasn't much for us to do other than help our orthopod, who was real busy. And go ahead. And this is him. He's in the red, and he's at the breeding. A young boy had a crushed foot, and our chief of surgery, Dr. Thosiak, is there, and the scrub nurse right now she's over at getting a CRNA in Mirbelet at Paul Farm Partners in Health Education Program, and there's our anesthesiologist. But it was a busy time. Yep. I'm just going to show you one slide, but an earthquake is a huge devastation, and normally as a surgeon you feel you can help, and I felt helpless. Nothing you can do. You basically can go and hug somebody who's digging for one of their relatives, and it was the whole town of Marceline caved in. They lost everything. I mean. So we came back to the Surgicenter, and I thought this would be interesting. So when you're building a roof, there's no electrical tools down there. Everything's done by hand. And you build a roof, you get a bucket brigade. And then somebody's cranking the cement down below, and then you get the buckets, and you pass the buckets up the ladder, and you can see the ladder. And this is done on a Sunday, so everybody in the community can help out. And you take one bucket at a time, you take it, another guy's got a 2x4, and he's leveling out the cement. I thought this was really kind of a community effort that was unmatched that I had seen. You've got 50 to 70 people up there, and they all want to see this thing go up. They're all helping. Yep. Oh, go back if you would, Alice. So the red mark over there is actually a village. And, this is a village. The only approach to this village is crossing the lake. They don't have anything. They don't have power. They don't have running water. They had a water filter that was broken. And I took down an engineer, a friend of mine who's a water engineer, Stephen Collins. And Stephen had the part. I showed him what was needed. And so we decided we were going to go over and see if we could fix that. Go ahead. And so we rowed across the lake, and these are a couple surgeons in our boat. And the boat I was in, he asked if I'd bail as we went. So because there's a little leak in the boat. But you row across the lake. Go ahead. And then you get there, and you've got a little welcoming committee. The kids are there. There's one of our boats in the background there that we came across the lake in. But it's actually called Village Across the Lake. I mean, that's the official name of it. And then, go ahead. And then we went, and that's Dr. Thosiak working with Stephen trying to repair the part. But, the kids just were a lot of fun. They just had a ball, and it was great to, get a chance. I left these guys alone. I went and played with the kids. So that was, go ahead, next. Then we came back. This is our new medical clinic that we built in 2020 and 21. This takes care of we have multiple clinics now. We have medicine, pediatric, HIV, dental, maternity, and surgery that we see about 13 to 1,400 patients a month, and that's with the roads closed. That's with the main road is closed. I mean, basically you can't get through. So they come in every which way to get to us. And this is part of our staff that was took this last April, and we had a meeting. I asked them. I said, "All right, how many of you are interested in the amnesty program and leaving Haiti?" And they all sat there, and no one stood up. I said, "No one wants to leave." They said, "No, we're here for the long haul." So I said, "You made my job a lot tougher." Yep. These are our medical director on the right. His name is Juno St. Louis, and his wife Tosh. She's our development director. Juno was really bright, went to Cuba for medical school, and then in the earthquake came back to Haiti. And I've seen that happen a lot. With the Haitians, some of them just want to get out, and there are others. When the earthquake occurred, they came back to Haiti to help, and he was one of them. And he's our team leader down there for the medical staff. And Tosh has gotten me involved in all sorts of community activities. When I hired her about a year ago, she said, "Okay, we're getting ready. I'll explain some of these as we go along." Go ahead. This is our emergency room that we've expanded. The emergency room, we've got a big area in the back. This goes back into the emergency room. This is just the front entrance for it right there. Mm-hmm. This is a cholera tent. We had a big outburst of cholera this past year down there. About 20 patients a week, young kids mostly. Bad water. They were drinking it, and they'd get cholera. And it's very easily spread, so you have to separate them from all your rest of your patients because it's easily the contamination factor. And we shared this with the Mennonite Clinic, which is down the road. One thing about when you're doing the work like this, you work in projects with other groups if you can. It's not, it's not us versus them. It's what can we do together. And for me to get a container down there, I usually work with one of the medical groups down there already established, or one of the orphanages, and you just work together. And it's a great bonding experience as well. This is our when the after our chief surgeon on his way to the hospital was shot in 2021, I said, I got to move my team out to the team that was traveling, the medical team. They, a lot of them live in Port-au-Prince and in the Croix-de-Bouquet, and it's an unsafe area. And I said, I've got to get them out there. So I got some land, and we built this medical facility up on the hillside. It's a great view from the top. You get to look at the lake, the whole valley. It's just terrific. This is, we're going to be finished in this summer and hopefully move in. This is for 22 of our house staff and their families. And we're hoping that we can keep everybody safe then. We don't have to do the dangerous travel on the roads and risk their health. So, yep. One of the things that Tosh got me involved with is a little orphanage up the road, up the hillside. And this is the Rise to Shine. I talked to the fellow who runs it he's in Denver, and he said, we're probably going to have to close. I said, no, you're not going to close. You don't close an orphanage. These are kids that don't have parents, and they're taken care of by their relatives or friends, grandparents, whatever. Their parents aren't around. The school, they have teachers, and they're learning French, the tenses in French. And they get 2 meals a day, and on weekends they get some rice to take home, and so they're fed, and that's a big deal in Haiti. Not only that, they have their teachers there, so they're learning and getting fed. So but go ahead, next slide. And they're just when a white fellow walks in, it's a kind of a whoa, blanc, 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 and they're just you just want to grab every one of them, take them with you, but you just can't, and they're wonderful. So we're involved. Yep, this is the school where they stay, this is their little school there. And in the back, that area is the kitchen area in the back, and on the right-hand side there is the school and where they have the teachers. And it was they'll have several classes going at once and different the teaching, and it's really not nice to hear that. The education going on for these kids, because that's something Haiti doesn't have in Haiti, education costs money. There's no free school there. You have to pay for education in Haiti, which is really a shame, even elementary. Yep. This is another project that we just got involved with. One of the problems with Haiti is that the trees in the mountains have been cut, and the runoff after a rain or during the rain season, which is usually late summer, early fall, you get terrible flooding. And so they came to me and said, listen, would you join us with this orphanage, this Love a Child orphanage? And he's a good guy, a good friend of mine, Bobby Burnett. And he said, Ted, would you be interested in helping us with this river diversion project? There are a lot of houses you can see along the side here that are subject to flooding. And you can see that. And what he said is we've got to divert that river. And so we're in the process of diverting that river right now. It's basically, we're spending, I think it's $91,000, as is he, and then we're going to find somebody that's going to give us another $91,000 for the rest of it. But we're going to get it started, and basically it's going to save all these homes here. And this is not, it goes further down as you come down the picture, but it's to save these homes. We had a bad storm not long ago. You may have read about it in the paper. Haiti got hit hard with a spring storm, and we lost about 7 or 8 kids that drowned. But we did save hundreds of homes because even though we have only about a third of the way there, we were able to divert enough water that we saved some homes. So that was a good part. Yep. So in 2022, and mind you, this is with the roads closed and fuel shortage. The tankers that normally we now have solar panels that are being installed as we speak. So that's great. To get rid of fossil fuel, I'm all in favor. But we did have a tanker for our generators that would come out, and they refused. They came out. We talked them into coming out to deliver fuel, and on the way back they got kidnapped, and the cost the company $10,000 to get the truck, and they said we're not coming out anymore. So my team would take 5-gallon tanks, the little plastic tanks that you use at home probably, and go to the Dominican and pick up fuel so we could keep going and keep the generators going for surgeries and so forth. So, they still did 490 surgical procedures, 40% unable to pay, 414 deliveries. We're the only area in the region, the wide region, that does C-sections. And so we get, that's a big deal down there. And then they 1,300. Normally we see about 1,900 to 2,000 clinic visits a month, but this is all monthly data. And then the 13,000. That's a year. That's for the year. I'm sorry. The 13,000. And the HIV patient. We have an active HIV patient. We work with the Catholic Medical Mission Board down there, and they supply the medications for HIV. And we have an outreach team that goes up into the mountains and also into the community to help with that as well. 2,300 trauma visits. The dentist is real interesting. Gee, I didn't see that picture. Anyway, the dentist is a guy that was on his way to Canada. And how are we doing on time, Alice?
You've got 5 minutes.
Good, thank you. The dentist was on his way to Canada. He stopped me when I was down there a couple of years ago, and he said, Dr. Ted, he said, is there any chance you can use a dentist? And I said, well, what's the situation with dentistry? He said, well, there are a bunch of people that pull teeth, but nobody does restorative work. And I said, well, why don't you stay here? And he goes, that's what I was hoping you'd say. And so he stayed. He has a mother and his sister. She is blind. She was, and she has 2 boys, and he wanted to be able to stay and help support. Well, his sister is about as dynamic person as I know, Emanuela, and the last name is really interesting. It's bon ami, good friend, and so she came to me about a year ago and said, we need rehabilitation down here. And I said, explain. She said, well, there's a lot of post-traumatic stress syndrome down here. And she said, I can help with that. Now, she's blind, can't see any. She said, I can help these people. You're wrong. So we've hired her, and she's about as, I've seen people with faith. And then there's Emanuela. She's just a very strong woman, and we've had a lot of kidnappings, we've had people robbed. People come they say they're late, and I said, what happened? Said, well, we got robbed on the way. And they still show up for work, and they apologize. You don't need to apologize. You don't have to do that. Okay. So what do we do? What do we charge? For our cases. So you want a hernia fixed? It's $60. But if you don't have $60, we'll still fix your hernia. So 40% are basically no charge. And just pay what you can, and and that's why we see a ton of people, because we're not there for the money. Go ahead. We have so how people have asked me, well, gee, you've got 80 some employees. How much does it cost you a month to pay for that? $45,000. Where are you going to find a better deal when you're doing operations like this and seeing all these people in the clinics and dental and you've got the community basically, and that's really it's just remarkable. And we've got it just gives you the rundown of what people make. Our nurses are and they're not complaining about their pay either. They're just glad to get paid, and and that's one of the things that's kept us going, is we've been able to keep them with funds, and we haven't lost any employees. This is what we are basically, for us. It's individuals that are keeping us going. We're starting grant writing, but I'm not a grant writer. and we're trying to boost that part up. But we've got individuals that have really, some of you here, that have helped out, and really that's our backbone, and that's what what we rely on. But we're doing a lot of construction. We've got a maternity center that's being built right now. We've got a that's going up, and it's going to have a patient care area, and on the second floor we'll have a memorial area for some of our people that have died along the way, and then we've got the medical staff living facility that's being finished, and we're remodeling part of the clinic as well in the back. It needs a rundown, but this is what we've got, and so we spend about $2 million a year, and we're still going. So I think that's at the end of the slides. I think that maybe. Oh, that's how you can, if you're interested in. Yeah, we're the hat's out, so But anyway, and the church has helped out. The mission committee has nicely helped out each year for us since we've been down there. So I've got some brochures back there if any of you are interested, and there's a gratitude report for people that have donated, and you can look at that and some of the things we're doing down there. But this was not something that I grew up thinking I'm going to be taking over a facility in Haiti. You just kind of run into this sort of thing. You take little steps. I was telling Joyce there a little earlier that you just take little steps and then suddenly things happen, and that's the way it's been for me. I saw a need, and I still see one. So that keeps going.